Hi, I'm Euriz Calmerin, currently working in a government and private institution in Bacalod City, Negros Occidental, Philippines. I graduated in University of St. Lasal in Bacolod and had my psychiatry training in Cebu. I'm interested in human behaviors, fascinated with the complexities of how the brain works, and I am also interested in mindfulness. According to American Psychiatric Association, therapy or psychotherapy is a way to help people with a broad variety of mental illnesses and emotional difficulties. Psychotherapy can help eliminate or control troubling symptoms so a person can function better and increase well-being and healing. Its objectives are to remove, modify, or retard existing symptoms, mitigate disturbed patterns of behavior, and promote positive personality growth and development. In therapy, different problems or issues may be tackled, like how to cope with the difficulties in life, medical problems, death of a loved one, trauma, separation, relationship issues, substance and other mental disorders like depression and anxiety. With certain issues or problems, several types of psychotherapy may be used. Thus, anyone can undergo therapy, and one does not necessarily need to have mental disorder to benefit from therapy. There are three different classifications of therapy. One is supportive therapy, which aims to reduce presenting symptoms or distress. It helps restore an adaptive equilibrium. Some approaches would be guidance, reassurance, environmental manipulation, prestige suggestion, and muscle relaxation. The second is reeducative therapy, where the patient is allowed to learn more effective ways in dealing problems and relationships. They learn to handle social, marital, and occupational problems that cause distress or anxiety. Some of the approaches in this therapy are behavioral and conditioning therapy, client-centered therapy, rational therapy, relationship, marital, and family therapy. The third is reconstructive therapy. The patient is directed toward basic and extensive modification of an individual's character by enhancing one's insight with the development of new adaptive personalities. Some approaches this therapy through psychoanalysis, transactional approaches, and play or art therapy. So the most common types of therapy used would be the cognitive behavioral therapy, dialectical behavioral therapy, the EMDR or eye movement desensitization and reprocessing, behavioral therapy, psychodynamic therapy, and mindfulness-based therapy. Most common is the cognitive behavioral therapy used by psychologists or psychiatrists. It addresses unhelpful thought pattern or problematic thoughts and making changes. In CBT, it is a triad of our thoughts, feelings, and behavior. What we think affects how we feel. What we feel affects how we think and do, and what we do affects how we think and feel. It replaces the negative maladaptive thoughts with positive and realistic ones. Usually, CBT is used for patients who have irrational thoughts, patients who have anxiety, depression, or substance use disorder. So on the other hand, dialectical behavioral therapy is a subtype of CBT as it prioritizes acceptance and emotional regulation. DBT is quite challenging as it has 4 modes of treatment. Group skills training geared toward control of emotional dysregulation and impulsive behavior. Individual therapy, which is held weekly for 50 to 60 minutes. A telephone consultation wherein a therapist is available 24 hours per day. Patients are encouraged to call with an allotted time of 10 minutes when they feel they are heading towards some crisis leading to injurious behavior. And lastly, a consultation team wherein therapists meet in weekly to review their work with their patients. Patients who benefit with DBT would be patients with borderline personality disorder and parasuicidal behavior. The other one is the eye movement desensitization and reprocessing, also known as EMDR. It is a variant of trauma-focused CBT. This has been used to patients with post-traumatic stress disorder, wherein an exposure and cognitive reprocessing interventions are paired with directed eye movements. Some studies show that inducing rapid eye movements while the person is thinking or imagining about an anxiety-producing event can yield a positive thought and decrease anxiety. EMDR is delivered 1 to 2 times per week with a total of 6 to 12 sessions by a trained professional. And currently, there are a number of therapists that use mindfulness-based therapy, wherein meditation, relaxation, and awareness exercises are used to help them focus on the present moment with the here and now. The key feature is acceptance. This approach is also helpful with anxiety, wherein an individual tends to ruminate with past concerns and future worries. It depends on how complex the problem or the issues of the patient, especially if it's trauma. It's very, very long, and the processing is also too tedious or hard. It depends on how the patient accepts it and what is happening with the therapy. And especially with trauma, you have to think about the proximity, the degree, the level of the trauma to that patient who did that. Those kinds of factors you have to consider. Some patients, like example, patients who have death of a mother or a loved one, it still depends. Some will undergo 1 to 2 therapy sessions, then they'll accept it and they're going to be okay. Some will have months to years until they're able to accept it and able to cope with it. It really depends, especially of how the support system of the family towards the patient's condition. So, negative stigma about mental health symptom and seeking therapy is one major obstacle in getting professional help. They have this fear being thought they are crazy or labeled as weak. Talking about mental health is also a taboo in many Asian cultures. They view it as shameful and should be kept private. Due to their prestige and strong value for family obligations, seeking mental help may give them less value with their identity and purpose, trying to avoid embarrassing themselves and their families. Some also has this belief that mental illness is a sin or a punishment, lack of faith, and can only be cured by prayer or good deeds. Presently, due to mental health awareness, help of the government and other agencies, together with the development of mental health law, people have been more aware and open with the thought of seeking professional help.